year, thousands of people die of sudden cardiac arrest.
He's unconscious. Go to the front desk, call 911 and bring me the AED.
Following the links of the cardiac chain of survival can help save lives. The sooner 911 is called, the sooner advanced medical care will arrive. Early CPR helps circulate blood that contains oxygen to vital organs. Most people experiencing sudden cardiac arrest need an electrical shock called defibrillation. Continue CPR until an AED is ready to use. An AED, or Automated External Defibrillator, is a portable electronic device that analyzes the heart's rhythm and determines if an electrical shock is needed to help the heart restore an effective rhythm. Most AEDs can be operated by following these general instructions. Turn on the AED. The AED will tell you what to do next.
Press pads firmly to patient's bare skin.
Make sure the person's chest is bare and dry. Use a cloth or gauze pad to dry the person's bare skin where the pads will be placed. Remove the pads from their packaging. Carefully peel off the backing from one pad and place the pad on the upper right chest. Place the other pad on the left side of the chest. Plug in the connector to the AED if necessary. The AED should start analyzing the person's heart rhythm.
Analyzing heart rhythm. Do not touch patient.
Analyze.
Do not allow yourself or anyone else to touch the person while the AED is analyzing.
Shock. Move away from the patient.
Make sure that no one, including you, is touching the person.
Red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.
After a shock is delivered, or if no shock is advised, give about 2 minutes or 5 cycles of CPR. When 2 minutes have passed, the AED should automatically begin to reanalyze the heart rhythm and will advise you with a prompt to stay clear of the person.
Do not touch patient. Analyzing heart rhythm.
Continue to follow the prompts of the AED and provide care as needed.
It is now safe to touch the patient. Start CPR.
If at any time you notice an obvious sign of life, such as breathing, stop CPR, maintain an open airway, and monitor for any changes in condition. An AED can also be used for children and infants who are not breathing. Use pediatric pads if they are available. Operate the AED and apply the pediatric pads to the child's chest the same way you would for an adult.
Do not touch patient. Analyzing heart rhythm.
Analyzing. Everyone stand clear.
For a small child or infant, the pediatric pads may be too large to fit on the chest without touching each other. You may need to attach one pad on the center of the chest and the other on the back between the shoulder blades. Here is how you would work with a second trained responder when using an AED. One responder continues CPR while the other prepares the AED. This is another example of how CPR and an AED work together as links in the cardiac chain of survival. One responder continues CPR while the other attaches the AED pads and operates the AED.
Do not touch patient. Analyzing heart rhythm.
Everyone stand clear.
Preparing shock. Move away from the patient.
Shock advised. Everyone stand clear.
Press red flashing button to deliver shock. Shock delivered. It is now safe to touch the patient. Start CPR.